Pregnancy is a beautiful journey filled with joy and anticipation, but it also comes with its fair share of challenges, doesn't it? One particular challenge that often arises in navigating the world of pregnancy is personal care products for our babies. Since it's a delicate time already, we have so many options available, and it can be so overwhelming for moms to be. So, together, we are gonna solve this query today as we have two experts with us who are gonna shed light on this vital topic. First, I would like to welcome a world renowned dermatologist, Dr. Jushya, who is bringing a wealth of knowledge in the industry. And on the other hand, we have a beauty influencer and a mother of an adorable child, Priyanka. Welcome to the show, ladies. So we are so glad to have you here.
Hi, Doc. Hi, Harsimran.
Hi guys, thank you for having us here, Harsimran. I'm so enthralled to be a part of this pregnancy thing that you're doing because it's so close to each mother's heart. And I'm glad I'm sharing the screen space with Priyanka, which I think is great because I've followed her journey for quite some time now.
Thank you so much, Doctor. Same here. I'm looking forward to this whole conversation because I'm a new mom. I'm still learning and it'll be great.
So shall we start?
Yes, please.
Okay, so my first question is to Dr. Jushya. So I would like you to address this burning question that I'm sure most of the expected mothers would be having, that are these personal care products that we have in the market are safe to use during pregnancy? And if not, which ingredients pregnant women should look for and what should we avoid?
So to be very honest, that to be able to label them as safe for pregnancy or not has to be a thing of lab testing, but for ethical concerns that we can't test product on expectant mothers or people who are breastfeeding, women who are breastfeeding, we don't really know a lot of things about what can actually be safe in pregnancy and what not. But from studies that we've had in the past and experiences from the past, we've gathered at least some products that are a complete no-no during pregnancy. And it's a great thing because a lot of brands do test out some products and they do label the products as pregnancy safe, or they will label it not for pregnant women. So before you're picking up a product, it's best that you go through the label carefully. If you're looking for certain ingredients that you must avoid, there are quick ones that are they're present in majority of the products that you can look for. There are things like parabens, there are phthalates, there are sulfates. I'm also not a big fan of fragrances, pregnancy or not, because the thing is, you're not only safeguarding your own skin, but you have to also safeguard your child, which means that if you're allergic to any of these things and you develop a rash, you will have to go on a medication which might not be safe. So steer clear from all these things that I just mentioned. One last thing I'd like to say, that certain ingredients that we otherwise love as dermatologists, we encourage you not to use in pregnancy. Those are like retinoids, salicylic acids, and sometimes benzoyl peroxide, especially in early pregnancies.
Yeah, I think that's a great point you've touched, because we know that we want these products for our daily skincare routine, but we should opt for products that look for hydration and nourishment on the same side, because we are just already going through so many hormonal changes in that phase, right?
Right.
Okay. So my next question is for you, Priyanka. As an influencer and a new mom of an adorable daughter, what personal care products have you found most beneficial during your pregnancy journey? I'm sure it must have been a roller coaster ride for you. So, what concerns did you have, and what questions did you receive during your pregnancy, your personal care products from your audience, basically?
So like every other mom in the beginning, when I got pregnant, it was very, very confusing as to what to use, what not to use. I honestly had not educated myself so much. But as the pregnancy went along, I did my research. I was reading blogs. I was consulting my dermat. Knowledge is everything. So, because when I get pregnant and when I reveal to my audience, they obviously they wanted to know more about, what products I'm using, what I'm doing. So, some of the common questions that I received was, DIY, but honestly, I am not someone who believes in DIY. So I believe I was relying completely on my dermat. Nobody knows more than your doctor. I truly believe in that. Of course, you read blogs, you read different blogs, and you follow the right kind of influencers who actually verified and who actually have a knowledge on skincare. So I was getting a lot of questions about products that are pregnancy safe, DIY, products that are affordable. So these are some common questions I received from my audience.
Okay. Now, my next question is for Dr. Jushya. I am sure, Dr. Jushya, that not many, almost every woman experience changes, a lot of changes in their skin during pregnancy. So it could be acne or it could be melasma. I've heard that melasma is also known as the mask of pregnancy. So what can they do to address these concerns without using potentially harmful products for themselves?
All right. So, there are few changes which are physiological during pregnancy. Don't consider them as a pathology, that this is a disease that I've caught, or this is there are things that are part and parcel of pregnancy, just like having a baby bump. That's what I tell most of my patients who are concerned about melasma. So melasma is called mask of pregnancy because it usually arises during the hormonal changes, and which is in a woman's life, 90% of the women in their pregnancy will develop some kind of pigmentation issues, most commonly melasma. Also, for a lot of women, this issue goes away the moment they deliver or they stop breastfeeding the baby. But it is not for everybody. So we have to know what are the safe alternatives. Encouraging products like a vitamin C or a kojic acid or azelaic acid, which are safe in pregnancy, is okay. You can try using these products, of course, under the guidance of your dermat if you are not very sure of what ingredients to use or what products to use. Second, sun protection. Melasma is, of course, it rises because of hormones, but it aggravates as a result of sun exposure. So even when you're indoors, try wearing an inorganic or a mineral sunscreen, something that is rich in iron oxide or titanium dioxide, zinc oxide. These things ensure that they're not absorbed, they form a shield on your skin and deflect the sun rays. They're very helpful in melasma. As to acne, there are two parts of it. For some women, acne surprisingly goes away during pregnancy. So they're like, doctor, we have never had this clearer skin, and which is what we call the pregnancy glow. And this, on the other spectrum, is a kind of patient, a group of patients who develop acne during pregnancy when they've never had before. And for some people, it just aggravates. So looking at the situation, we tell people to enjoy the pregnancy phase, not stress too much about acne, because acne will come and go, but pregnancy is a one-time thing. It's a 9-month phase that you must thoroughly enjoy. Also, having positive feelings about yourself is important because that reflects on your baby. And acne could really have a mental, it can cause mental stress. For acne, I encourage patients to not be on any treatment for first 3 months, except for simple things like a gentle skin cleanser, avoiding any kind of salicylics. And you can always, moisturize your skin with, let's say, a hyaluronic acid. Use some acids like a glycolic acid. Azelaic acid is also fine in pregnancy. However, as you're in second trimester, a lot of medications start becoming okay. So then you can take help of your dermat to address these issues.
So did you both have that pregnancy glow, or you were just too worried about the concerns? What did you have?
So, fortunately, I had the pregnancy glow, and I'm fortunate about that because I've always dealt with acne. I've had my own journey with acne for, like, say, 20 years now, since I was a teenager. So I kind of really enjoyed it. Apart from, of course, the nausea and the other things that pregnancy gives you, at least my skin was okay, so I was quite happy.
So for me, it was kind of confusing because some days I was glowing, some days, the pigmentation aggravated. So it was really confusing what's going on with my skin.
I'm sure you both ladies have done a fantabulous job in pulling that pregnancy off. Okay, so my next question is for Priyanka. Priyanka, have you found any particular beauty or maybe skincare ritual to be therapeutic during your pregnancy? Since I know you're not a fan of DIYs, but you must have had some ritual for yourself. And also, did it contribute to your overall mental well-being? Because you just said you were a little stressed during that.
So pregnancy is a 9 months journey, and it is hard. You can't deny that. Your body goes through a lot of changes. You mentally, hormones are upside down, so you are mentally not prepared for this. When your body is going through that kind of change, but you have to come into that mindset where you have to think about your mental health. You have to think about your baby. So for me, these a little bit of indulging into self-care was very important, having a very simple and a very effective skincare ritual. Like, for example, I did my research, and I had chosen a few safe pregnancy products, and I kept it in front of my, in my bathroom. And, I knew that these are the products I'll be using and nothing else. So indulging into a simple, skincare ritual, like, cleansing, toning, moisturizing, that was something that, I was doing it every night, and I was happy about it, because I know whatever I'm putting in my skin is safe. Then also, like, something like indulging into a bath or something, all of that contributes. These are, even I tell my audience, don't complicate it, keep it very simple. I hope doctor agrees with me, keeping your, when you're not a doctor, you are a blogger. So, keeping it simple and effective is something that, I did during my pregnancy. And I also encouraged my audience to do the same. When you don't have too much knowledge, just keep it simple. Something like, products with hyaluronic acid, or avoiding retinols or salicylic acid was, something that I, spoke about, because I was confident about these things. So I spoke to my audience about it. So yeah, simple, keeping it simple, and what it, what you're doing, you have the knowledge about these products, so it makes a difference. Yeah.
Keeping it simple would be your mantra, I believe.
Yes, absolutely.
Perfect. So now, Dr. Jushya, I would like to ask you about some misconceptions regarding personal care products, which you must have heard being a dermat and such a renowned dermat. So would you like to clarify that for our audience, please?
I think the most common I hear in pregnancy is that, doctor, I've been using all natural products. I think that's really broken my heart at many points of time, because it just takes me it takes me a lot of time to explain it to them that natural doesn't mean safe, and also that most of the ingredients that other brands are putting in their products are also derived from nature. It's just that they're mentioning the chemical formula that they're derived from nature. Not so, and not everything is like synthesized in the lab. And so this is a very rampant thing in India, because we believe that whatever we've used from home, or if a brand has labeled a product natural, all natural, they don't know that it could be just the way of marketing the product, and it might not be safe for you. So especially when you're pregnant, you must be very careful. Talk to your dermat before you indulge in multiple things. Like Priyanka said, simple things which I can mention for you, like a hyaluronic, azelaic, these things they're actually vitamin C's. These are all safe in pregnancy. So you can go ahead and use them. But don't depend on a product too much just because it says it's natural.
Okay, so guys, I think we have talked enough about skin now. I would like you to touch upon hair care, please. So, Priyanka, what are your go-to tips, or what were your favorite things you did for maintaining those healthy hair during pregnancy?
With my hair, I was like I said, I kept my beauty ritual very, very simple. I was using products which were safe. Like doctor said, it's all marketing. People say natural products. It's not something that would be safe for your pregnancy. So you have to do your research. So I kept my for example, for my maintaining my hair, I was using sulfate-free products. I was going for simple head massage, using coconut oil for my head massage. I did that. And also minimizing styling tools, because on a long run, because I'm a blogger, whenever I go for my shoots, I have to blow dry my hair, I have to style, I have no choice. So when I was at home, I was not blow drying, I was air, what do you call that, air drying my hair. So all these helps a lot, on a long run, little things. So using sulfate free products, using less styling tools, these things, yes. Massaging, these are the only DIY that I did, going for a little head massage, with coconut oil. So yeah, I did that.
So this just gives me another question I really want to ask, that since you are a person who loves to keep it simple, Priyanka, how do you balance that desire to experiment with new beauty products? Because we see so many beauty products here and there, they claim to be safe for pregnancy and all, but how did you balance your desire? And if there are any particular resources or guidelines you used to follow?
Yes, it's very tempting because there are so many products in the market, claiming so many things. You want to try everything, but again, you have to be very mindful because you're not you're an expectant mother, so you have to be very, very mindful of what you put in your skin, because that will go to your baby. So for me, I said I did my research. I was reading blogs, and most importantly, you have to trust your dermat. Nobody knows more than your doctor. So consulting your dermat, you have to find your right dermat, and you consulting your dermat, they would guide through the products which are safe, which are not safe, because once you have that knowledge, then only I would go on social media and talk about pregnancy safe products to my audience, because I just cannot say anything out of something which I am not aware of. So yeah, Google search, and Google is not always the right thing to do. I'll be very honest, because there are so many confusing things on Google as well. So yeah, I would say for me it was my dermat.
Okay, so let's talk to the dermat we have in the house, Dr. Jushya. I know that we have already spoken about what things we should look for, but I would again like you to touch upon what products or what ingredients pregnant women should strictly avoid.
Okay, so we've spoken about this before, but I'll just give you the logic behind why we're asking you not to use that. So retinoids is one thing that we've known for quite some time now that it's not safe. In fact, topical retinoids or retinols have less data, but we'll still like to avoid them because we have a lot of data on the oral isotretinoin or oral retinoids, which are primarily used for anti-acne and anti-aging. Now, why are these unsafe? Because they are vitamin A molecules that actually inhibit a lot of organ formation in the baby. So, we've seen cases with actually limb deformities or less organ formation, half of a heart formed, half of a liver formed. So they're really, really unsafe. It's category X, and they have to be avoided at all costs. When people come and visit me in my clinic, I tell them to steer clear of them as soon as you start planning for a family, so that is the right time, not just when you know you've conceived your baby. Second thing I'll ask you to avoid is the salicylic acid. Especially, I'm seeing a surge of salicylic acid body washes and body lotions. So a lot of women develop the strawberry skin during pregnancy, and they're like, we can use a body lotion. How bad could a body lotion be? But salicylic acid is an oil loving molecule. It dissolves in the oil glands and reaches deep into the layers of your skin, which is fortunately not the case with the glycolic acid. It is a water soluble thing, so it stays on the skin surface. So anything that's oil soluble, we don't want it to penetrate. So salicylic acid is, again, I'll ask you not to use it because it is absorbed in your bloodstream. Third thing is fragrances. Sometimes we feel that these essential oils that are filled with nice aromatic perfumes and all of that, those are extremely, it's all about self-care. We feel that, let's just lit a small candle with fragrance and sit and just have a nice massage. But unfortunately, fragrances can lead to a lot of allergies. And like I mentioned before, if you develop an allergy, we don't want you to use the medication we otherwise give you, because that can harm the baby. So stay clear of this. Priyanka rightly mentioned that coconut oil, I'm a big fan. I think coconut oil is very safe for pregnancy and for the babies. So that's something I tell my people, people who visit my clinic to stick to that. Also, avoid things like sulfates, phthalates, parabens. These things are to be avoided in your routine.
Yeah. I think we've talked about hair, we've talked about skin, but I would like you guys to talk about the mental stress pregnancy brings. So, Priyanka, being an influencer and a blogger, I'm sure social media must have put a lot of pressure on your mental well-being when you were pregnant. So, how did you deal with it, and how would you advise the expectant mothers to deal with it?
You don't have to be like those mothers who just go on Google or on social media reading about it, like like a headless chicken. You just I kept myself off social media. I limited my time on social media. I was mostly focusing on my work, and this unnecessarily Google search. When I met my guy and actually told me stop Googling, you know too much, because as a new mom, you are so like clueless about what's going on in your body. Your skin is changing, I had like really I had like my pigmentation aggravated. So of course, you do get stressed, and when you look a certain way. So I used to be a size UK 6, and now I'm a I was not fitting into my clothes. So these are the things you go through. But you know what, I had a baby late, so that helped a lot. You come into that mindset, you're more mature, that way. So you know um, what to do and what not to do. And yes, most importantly, listen to your dermat. Listen to what she says, how she guides, and your guidance.
Yes. Also, Dr. Jushya, just one last question I'm going to bother you with. I'm sure as a doormat, you must be knowing that there are connections between stress levels and skin conditions during pregnancy. So, how can we balance that?
Okay, so mind and skin are very, very well connected. We've had research on that. There is a lot of evidence supporting this theory that the nerve firing can affect your skin, and it can aggravate situations like pigmentation, acne, eczemas, and rashes on the body. And why does this happen? Because when you are under stress, your body releases a protective hormone called cortisol, which is like a steroid, and that reduces the immunity of the body because it's trying to protect you. It's not trying to cause any inflammation in the body. To protect yourself from that inflammation, it's causing a lot of trauma. So on the skin, it's causing a havoc on the skin. So my suggestion is that we ask you to, take some time out for yourself. Remember that 9 months of phase is not going to come back if you this is the only baby you're planning. But remember that it happens with you for only once or twice in your lifetime. So let's not just miss this chance to love yourself. Take time, even if I was a mother, or I was a girl who was extremely career driven, and I thought to myself, okay, this is the time I can take a break, maybe not think too much about others, and just give your time to absorb your own body and see how you're feeling. Also, having a partner who you can discuss with is very important. So talk to your partner, talk to your in-laws, talk to your parents, because elders know a lot about pregnancy. They've had their own things with it, and they will suggest you things, and that will help you relax. Watch some nice things on TV, read a lot of books. These things can help alleviate stress, and it can also reduce a lot of skin issues that you might have.
Bingo. I think you just guys are the expert in everything the expectant mothers would want to know. And it has been such an informative discussion with you guys. Thank you so much.
Thank you, Harsimran. Thank you, Doc. It was real pleasure, and I have to get in touch with you.
My pleasure, totally. I'm so glad that this was such an insightful session. Every time we've had a collaboration with Requel, when we've spoken about, I'm so glad that we've spoken about relevant health issues, and that this brand is taking forward podcasts and associations like these that help broaden the horizon of information that we're about to give to our listeners and audience.
It was a great initiative by Requel, because not all brands do that. Not all brands are very transparent about, so this was really, really insightful, and I think this was very, very informative also for me. So
thank you both. And it was only because of you two that we were able to pull it off so well. That brings us to the end of this enlightening discussion on pregnancy safe personal care products. And just remember that the journey of pregnancy is unique for every individual, and it's very important to prioritize safety. And like our guests said, consult with dermats, have a gynae, trust them, and make very informed choices when it comes to personal care products, especially during pregnancy. And just once again, a heartfelt thank you to both of you for sharing your invaluable information. Until next time, please take care and stay healthy. Thank you so much.